If you or a loved one has ever experienced a hernia, you know how painful it can be. It's so important for patients to know they have options when it comes to the materials used for repair. We begin with one patient's story. Take a look.
My name is Mark Sear. I live in the Boston, Massachusetts area with my lovely wife and my son. I've been working in the medical field for about 30 years. I was coughing and I felt some discomfort in my abdomen, and I was concerned something might be wrong. I decided to go see a physician that I was referred to. The surgeon diagnosed me with a hernia. At that time, the only option that was given to me was to have a synthetic mesh implanted to secure the area where the hernia was. I had a little apprehension about it, that synthetic mesh is going to be in there for the rest of my life. But at the time, that was my only option.
Mark's surgery was a success, but he continued to have a periodic tugging sensation where the synthetic mesh was placed.
I started to feel some pulling and tugging, and it was restricting me, and it was making me uncomfortable when I did certain things. And as a father of a young child and someone who participates in many different types of sports, it was bothersome to me. I went back to my physician, and I told him my symptoms, and he said it's not uncommon sometimes to have some patients have discomfort with the synthetic mesh. It's unfortunate, but that was the option that we had at the time.
We visited with Dr. Paul Szotek of the Indiana Hernia Center to learn more.
A hernia is a hole or a protrusion in the anterior abdominal wall that is a result of a weakness that has occurred over time and allows an internal organ to protrude. Abdominal hernias occur in the groins as well as around the umbilicus. Hernias occurring in these two locations can be a result of aging as well as repetitive stress in the groin area or around the umbilical area or previous incisions. The signs and symptoms of a hernia are bulging through a certain location where you think the hernia is located, redness at that site. Hernias can be noted to increase pain with lifting, coughing, and these are often the times when we first notice them. Hernia surgery can be divided into two basic different modalities: open incisions versus minimally invasive surgery. Hernia repair involves stitching the hole closed and then reinforcing it with some form of a reinforcement, whether it be a permanent synthetic mesh or a non-permanent mesh or a reinforced biologic material.
In the United States, over 1 million hernia procedures are performed every year. The economic burden of hernia repair accounts for approximately $48 billion of healthcare expenses annually.
The data shows that reinforcing this hernia repair with some form of reinforcement material will ultimately result in a less chance of you getting a recurrence for the hernia. Other factors that can result in recurrence of hernia are increased weight gain, return to activity too soon, and overall poor health as you age.
If a patient suspects they have a hernia, it's important for him or her to get it evaluated by a doctor and to know they have options when it comes to the materials used for repair. Current surgical mesh options available fall into several categories: permanent synthetic mesh, resorbable synthetic mesh, tissue-based mesh, also known as biologics, and a newer category known as reinforced tissue matrix. Permanent synthetic meshes are made of plastic synthetic materials that will remain in the body for the lifetime of the patient. Due to their synthetic nature, they can generate a foreign body response. For some patients, this may lead to chronic inflammation, potentially causing pain, injury, and subsequent surgeries. Resorbable synthetic meshes are similar to permanent meshes in that they are manufactured from synthetic fibers which may cause a foreign body response. However, these synthetic meshes will resorb completely over time. Biologic meshes are predominantly sourced from animal tissue, which may be better accepted by the body than synthetic materials and generate less of a foreign body response. However, over time, the animal tissue may weaken and stretch, potentially reducing the strength of the surgical repair. These products can be quite expensive, which may limit their use to select procedures. Similar to biologic mesh, the reinforced tissue matrix category utilizes animal-derived tissue. However, in this case, case, the tissue is reinforced with small amounts of either permanent suture for long-term reinforcement or resorbable suture for temporary reinforcement. In both versions, the intent is to provide additional strength as the body heals after surgery. Because there is very little suture material, the reinforced tissue matrix has been optimized to reduce the potential for a foreign body response.
In my practice, due to growing concerns over the permanent synthetic meshes as a result of increased patient education, we have gone to a model of shared decision-making. In this model, we look to take into account the values of the patient when deciding reinforcement materials for their hernia repair. During our office visit, we go through each of the different categories as well as discuss the recurrence rates, the complication rates, and the patient's preferences. Ultimately, the patient is empowered to decide which material they would like for reinforcement of their hernia.
7 years after his first hernia repair, Mark was diagnosed again, this time with one on his right side.
I was concerned about putting a similar product in that was on the left. I quite frankly didn't want to do it. So I started to do some research because I did want to look for some options because, I'm considering maybe even not having it done. And during that time, ironically, there was commercials on the television about the synthetic mesh in patients that have caused a lot of problems. And coincidentally, one of the friends I had discussion with educated me on a product that is more natural tissue-based. And I approached my surgeon with it. He did know about it, and we both decided that it was the best way to go moving forward.
OviTex Reinforced Tissue Matrix is a more natural hernia repair option. OviTex represents a significant innovation in mesh design and was developed in partnership with surgeons in application of novel engineering principles. It is made of biologic tissue and surgical suture that is interwoven in a lock-stitch pattern to provide its strength. OviTex has been purposefully designed to provide a strong tissue-based repair which supports natural abdominal wall function while minimizing the risk of a foreign body response. With consistent clinical results, OviTex helps address the clinical and financial concerns of traditional hernia repair implant. The following adverse events have been reported for surgical repair of hernias with or without a surgical mesh: pain, infection, hernia recurrence, adhesion, bowel obstruction, bleeding, fistula, seroma, perforation, mesh migration, and mesh contraction. Talk to your doctor about whether OviTex is right for you. Because OviTex is a newer product, it was not originally available at the hospital where Mark was to have his second surgery. Some hospitals can delay introduction of new technologies due to their policies, and that can limit the innovative products they are able to offer to their patients. Mark's surgery was delayed, but eventually OviTex became available for his procedure.
After recovery, I recognized that there was some differences between the right side and the left side. I did not have any of the pulling, any of the constriction that I had on the right side where the new product was put. I'm very active. I bike, I ski, I play basketball, I swim, and obviously I play with my child quite often. And in doing all those activities, I have felt no discomfort at all on the right side of my body.
So the addition of the reinforced biologic material OviTex has really provided a new option for our patients within our practice that has increased patient satisfaction. We've been able to minimize their foreign body, minimize their chance of chronic groin pain, and minimize their complications while still providing with that minimally invasive repair that will allow them to recover faster, return to work faster, and really overall improve their quality of life. In addition, we have not noticed any changes in the recurrence rates or any other issues associated with using this product in minimally invasive repairs.
I really wish OviTex was an option back when I had that procedure done. And for anybody that's considering a hernia repair, it's worth talking to your doctor about OviTex.
Talk to your doctor about whether OviTex is right for you. To learn more, visit telebio.com or just go to our website, thebalancingAct.com.